In this video, we're going to be talking about the discs in your spine. So if you've been told that you either have a swollen disc, a degenerated disc, or a herniated disc, then this video is going to be of great interest to you, so stay tuned. Hi, I'm Dr. Miguel Cruz at Cruz Life Center in Burnsville, North Carolina, and we see a lot of people in our office with disc problems, and we get great results. Unfortunately, a lot of folks are being given wrong information. They're told there's either nothing they can do about it, or they have to have surgery, and that is very far from the truth. So we're going to start with a thorough explanation of what's really going on in that disc. Here's a video that I'm going to use as a demonstration, and what I want you to see what you're actually looking at. Here's a model of your spine. Here's a side view, and this picture here is basically cut right through the middle of the disc, and we're looking down as if we're looking down this way here. So what we're seeing is your disc. These little green flashes represents the nerves, the nerves firing normally. Here's your spinal cord, and this is your nerve that comes out from in between the spinal bones themselves. In the middle here is what's called the nucleus pulposus. Think of a ball bearing. It's under pressure. It's 90% water. This is the part that gives us problems. What happens in the case of a bulging disc, the nucleus part starts bulging through the disc, and in this case you can see it's putting pressure on the nerve, and that's represented by now, instead of a green flashing ball here, it's red because that nerve is now not working properly. Now I want to break this down into a little more detail for you. What I've got an example of here is what this nerve actually looks like. So what you see here is what we call a nerve root, which is composed of thousands of individual nerve fibers. And within those nerve fibers, they go to different parts. So this old telephone cable here is a good representation. What's important to know is that less than 10% of the nerve fibers carry pain signals, which would be like this small bundle right here. The other 90% are either going to organs or they're going to muscles. They don't necessarily feel any pain at all. So you can have a problem putting pressure on those nerves for many, many years, causing you some health problems, but maybe not necessarily a lot of back pain. So it's important that you understand that for this next part. Now here's an example of the same thing, looking at it from the side view. This would be a normal right here. Here's that nucleus pulposus, that ball bearing we were talking about. And in the case of a swollen or herniated or a disc, you can see that is now bulging back against the spinal cord, against the nerve, and it can be causing some problems here. That's an example of an irritated nerve there. Now here what we see is the same thing in a model. This might be a little clearer to you. You can see here, there's the swollen disc putting pressure on the nerve right there, but I want you to notice there's still room for that nerve to actually get out of the way. So you can actually have this going on for years without a lot of pain. There's been MRI studies done of people with proven swollen, herniated discs that were not in any kind of pain because of this situation right here. Now, I'm going to give you an example of what happens when they do surgery. So here's our swollen or herniated disc, and this is an example of a type of surgery that they'll do where they'll go in there and cut out that herniated part of the disc, and then they'll fuse that. In this case, they put metal bars in there to fuse it. Now this area right here may not give that person any more troubles, but what happens is the one above or the one below now gets overworked as a result of that, and then that area starts to break down next. That's why a lot of people will end up having to go back for a second or third back surgery, because it just keeps spreading. Now this next example is to show you an example of where the pain might be coming to, or what other symptoms you might be having. So remember, you have nerves that go to your muscles, you have nerves that go to your organs, and then you have nerves that just cause you pain. So this will help explain more of that to you. So if the problem's in your lowest disc, in this case, You see, those nerves there can be controlling your bladder, your reproductive organs, and your colon. So you might have physical problems with those areas there. Also, over here you see that nerve goes down your outer thigh, down into your heel, and in this case, into the front of your calf muscle right there. So you might have pain, numbness, or tingling in those areas. If we go up to the next vertebrae up, L4, this also, same organ structures are supplied, but it seems to go a little bit further up the leg and across the back into the hip area. If we keep moving up, now we start getting into a different part of the colon and your bladder function, and the pain starts going up into the upper thigh area and the inner leg, either pain, numbness, or tingling, or weakness for that matter. Now those lower three vertebrae and discs are the most common ones, but you are capable of having problems in the ones above there, which also, these will start causing problems in the groin area, as well as parts of your colon. So I hope this has helped to clarify some questions you may have had about what's really going on inside that disc. But what I want you to leave with is understanding there is hope available for you. Don't think that just because you've been told this, that you have to have back surgery somewhere down the road, because there's so many treatments that are available. In our office, as I said, we see a lot of people with back problems. We get great results. Chiropractic itself has been very well proven to get excellent results with back problems. And we use also what's called low-level laser therapy, which we've had fabulous results with. It has been proven to reduce the inflammation, take the pressure off the nerves, and actually helps to heal the disc to some level. If you want more information, I encourage you to go to my website. The information is there. And click on the videos tab, because I've got videos explaining all the different therapies that we offer. And I encourage you to do the research, see what needs to be done. Thank you. God bless.